Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. A quick note everyone, am I audible and visible everyone? Yes? Okay, that's great. So here we are into our next sprint session, which is pharmacology sprint. And this is just a sneak peek into, the topics that have been covered in the Sure Shot and MedSynapse app. Right, these topics have been covered in detail with all the concepts and the tricks there. So we have handpicked some most important topics from that also, so that it's easy for you to revise at the end. And like every session, you have the pharmacology sprint test, which is live on the MedSynapse app in the Short Shot Sprint course, which is a free course for everyone. So whether you are subscribed or not subscribed, you just need to have the MedSynapse app and please give the test. These are mini tests, just 10 questions, right? So once you watch the session, give the test on the app and see how you score, how much of what you have watched you actually remember, right? Solving MCQs, giving these mini tests, they are the best way, to assess yourself and for active recall, okay? So let's start with this one. The PDF has already been uploaded on the Telegram group and will be uploaded on app as well, both the blank and the annotated PDF. Okay, is this clear with everyone? Yes, Vinay. The blank PDF has already been uploaded on Telegram group and annotated will be uploaded on the app, both blank and annotated. So to every video in the app, we have attached the blank PDF, annotated PDF and the test, right? So at one place, you get everything in the app, right? So let's start discussing the topics. The first one, general pharmacology may say, right? So this is active recall session. So we'll do it together. Tell me, what is this called as? Something which binds to the receptor and after binding it produces an effect opposite to the baseline activity. Is this an antagonist, agonist, partial agonist? What is it? It binds to the receptor and produces an effect opposite to the baseline activity. What is this called as? Correct. This is called as inverse agonist. Okay, what is this? This is inverse agonist. So inverse agonist has intrinsic activity of +1, 0, -1. Remember, this is going below the baseline, opposite direction. Below matlab minus. So the intrinsic activity is -1. Example of this is beta carbolin is an inverse agonist at the GABA A receptor. Okay. Next one. What is this antagonism, which occurs when two drugs act on two completely different receptors and they produce opposite physiological effects? So what kind of antagonism is this? Yes. The receptor is not the same, like, competitive inhibitors, competitive antagonists binding at the same receptor. But it is not like this. What is this? This is this pharmacological, chemical, physiological? This is what antagonism? This is physiological antagonism, right? The term itself tells you there are opposite physiological effects. Example of this, adrenaline and histamine. They produce opposite physiological effects. Adrenaline causes bronchodilation, histamine causes bronchoconstriction, but they are acting on two different receptors. Adrenaline on beta 2 receptor, histamine is acting on histamine receptor, right? So this is a PYQ. Remember, this is physiological antagonism. And what antagonism is this one? Chelating agent is an example of what antagonism? Chelating agents is what antagonism? How have we remembered it in a short course? Thank you so much, Abhishek. Right, remember chelating, CHE, it is what antagonism? It is chemical antagonism. What is chemical antagonism? The antagonist is binding to the chemical, the drug itself, not to any receptor, right? It's a direct chemical reaction which renders a toxin inactive without involving the receptors. Okay? Example, you have chelating agents like dimercaprol bal for heavy metals. Another example, protamine sulfate, which is an antagonist for antidote for Heparin, it binds to heparin directly, right? So that is chemical antagonism. Okay. Going to next one, therapeutic index. How is it calculated as? What is the formula for therapeutic index? Remember, the mnemonic is TILE. First comes the L, then comes the E. LD50 by ED50. Lethal dose upon effective dose. We don't look for lethality, death in humans. So lethal dose is replaced by toxic dose. Okay, not the lethal dose, but the toxic dose. So it is calculated as TD50 or LD50, that is toxic or lethal dose, divided by ED50. Drugs with what therapeutic index require therapeutic drug monitoring? Narrow therapeutic index or a wide therapeutic index? So therapeutic index is like, this is the level where the drug, these levels of that drug are fine in the body. But इससे थोड़ा सा भी ज़्यादा हो गया, then there are effects, the bad effects in the body, right? It starts becoming like a toxin. That is why the drug which has a narrow therapeutic index, right? इधर से इधर हो गया और फिर यहाँ हो गया, तो then the effect is going to be seen, the bad effect. So the drugs with narrow therapeutic index, they need therapeutic drug monitoring. Example, warfarin, lithium, digoxin. Okay, so therapeutic index basically is a measure of what of the drug? The safety of the drug. It is not for potency or efficacy. It's a measure of safety of the drug. How safe or how unsafe the drug is. Which asthma wala drug is a narrow therapeutic index drug? What asthma drug is a narrow therapeutic index? Remember theophylline की toxicity पढ़ते हैं हम. राइट जो भी ड्रग की बहुत टॉक्सिसिटी पढ़ते हो मतलब इट्स अ नैरो थेरापेटिक इंडेक्स वाला ड्रग ओके नेक्स्ट वन maintenance dose is calculated by multiplying drugs what by the desired steady state plasma concentration. So what is the mnemonic for maintenance dose? Remember MCP, right? You have LVP and MCP. MCP is maintenance dose is clearance multiplied by plasma concentration, right? So you need to multiply clearance by plasma concentration. Loading dose LVP is volume of distribution into plasma concentration. Okay, clear with everyone? Yes, very good. Going to next one, zero order kinetics and first order kinetics. In zero order kinetic, what constant dash of a drug is removed over time regardless of the plasma concentration? Is it a constant amount or a constant fraction? किस में आता है constant fraction, किस में आता है constant amount? Remember first order F for F. In first order, it's a constant fraction of the drug which is eliminated per unit time. Here it is constant amount. Remember O for zero. This is zero order kinetics. So constant amount is zero order, constant fraction first order. Remember F for F. Absolutely right. Okay, that's the trick to remember this. Going to clinical trial, what phase is done in healthy human volunteers? Why do you do in healthy human volunteers? To understand the pharmacokinetics. How is the drug moving in the body, from where it is excreted, where it is metabolized, how safe it is, how is it tolerated. So healthy humans is going to be phase 1. That is how you start the human trial. Then you have the phase 2, which focuses on proof of concept or the optimal dosing in actual patients, right? So where do you start with the actual patients? It is in phase 2. And in which phase you have randomized control trial? Remember RCT is 3 words. So it is going to be phase 3. Okay. So where you have one group taking the old drug and other group taking the new drug and you compare. Okay. Done with this. Going to the next one. Autonomic nervous system. Cholinergic wale mein organophosphorus poisoning. So in OPC poisoning, basically it irreversibly inhibits acetylcholine esterase, and that is how it increases the acetylcholine levels, right? So that is why everywhere there is constriction and contraction. So increased secretions is what is seen in OPC poisoning. Constriction of the pupil is what is seen. So what antidote is given here? One to block the muscarinic effects and other to reactivate the enzyme, to revive the enzyme which is dying. So to block the muscarinic effects, what do you give is atropine. And for reactivating the enzyme, what do you give is prelidoxim. Okay, what do you give is prelidoxim. Please remember it like atropine, TROP in atropine, TROP. It treats OPC poisoning. Atropine treats OPC poisoning. So that's an antidote for OPC poisoning. Next one. What is this drug which is used for tensilon test for diagnosis of myasthenia gravis? It's a very short-acting acetylcholinesterase inhibitor, and that is why it is used in diagnostic tensilon test. What is that drug? Yes, very good, Dhanush. Absolutely right. That is edrophonium. Okay. Remember, it is edrophonium which is used in the diagnostic tensilon test. How do you remember it is? Edro is DR. Remember, doctor makes the diagnosis. And what is used in the treatment? What helps you get rid of myasthenia gravis? That is pyrid. Pyridostigmine is used for treatment. Okay. So pyrido, rid of myasthenia gravis. Edro, doctor makes the diagnosis. Edrophonium is for the tensilon test. Okay. Next one. What is this drug which is used in glaucoma? It's a direct cholinergic agonist. So cholinergic, what will it do? It will constrict the pupil. COCO. Cholinergic constricts the pupil. So by doing that, it is pulling the iris away and opening the trabecular meshwork, and that is how the flow is increasing. What is this drug here? What is this drug here? Cholinergic. Remember cholinergic. Very good, Anubhav. It is pilocarpine. Okay, how do you remember? Pilocarpine, LOC is COL. It is cholinergic. Okay, remember pilocarpine is cholinergic. It's a miotic drug. Constricts the pupil. Okay, it is pilocarpine. Very good. Going to next one, adrenergic. In adrenaline, what concentration is used for anaphylaxis and what concentration is used for cardiac arrest? Remember, the mnemonic is ACL. Anaphylaxis 1 in 1000, 1000, 10,000, 100K. That is 1 lakh. So anaphylaxis is how much concentration? 1 in 1000. For cardiac arrest, it is 1 in 10,000. With L is with lignocaine. You give it in 1 in 1 lakh to 2 lakh. Okay. So remember, the mnemonic for adrenaline concentration is ACL. Anaphylaxis, cardiac arrest, and lignocaine. Okay. What is this drug which is highly selective D1 receptor agonist? It is used in hypertensive emergency. It causes renal vasodilatation, and that is how it improves the GFR and the urine output. So it is used when there is oliguria. What is this drug here? Remember, it is acting on D1. D is dopamine, right? Dopamine ka receptor hai, first receptor, D1 first receptor. Nahin, Dhanush, don't confuse. This is phenoldopam. Okay, remember dopamine pe act karne wala phenoldopam. It is pheno is acting on the first, the D1 receptor in the kidney. It is phenoldopam. Okay. Going to next one. What is this one here? What is this receptor, this drug acting on? Prazosin. So it is used for hypertension also and BPH also, right? And remember, this group of drug is the one which causes first dose orthostatic hypotension, right? So with the initial dosing, the orthostatic hypotension is more and then it gradually decreases. What group of drug is this? Alpha 1 blockers. Remember, prazosin is sympathetic inhibitor, alpha 1 blocker drug. Which is the alpha 1A selective wala inhibitor? Prazosin is alpha 1A and B both. That is blood vessel में भी होता है, prostate में भी होता है. Alpha 1A selective कौन सा है? मतलब जो prostate specific वाला है. That is tamsulosin. Remember, selective inhibitor is tamsulosin. Okay, that is tamsulosin. Going to next one, cardiovascular, renal, heart failure. What is that drug which increases the cardiac contractility? So symptomatic relief is there, but it does not increase the it does not affect the overall mortality. It does not decrease the mortality. What drug is that? Remember, digoxin. Very, very important. Digoxin increases the contractility. How? By increasing the calcium in the heart. By acting on what pump? What does it inhibit? It inhibits sodium, potassium, ATPase. All of this has been discussed in detail in the short entire course. Okay. So, but remember, it does not decrease mortality. What side effects do you see with that? Xanthopsia, xantho matlab yellow, so vision yellow hoga. And digoxin toxicity is precipitated by what electrolyte abnormality? Very, very important. What electrolyte abnormality precipitates digoxin toxicity? Yes? It is hypokalemia. Remember, it is hypokalemia. Okay. So, like example, when you use furosemide, diuretic, causing hypokalemia. So, that will precipitate digoxin toxicity. Okay. Remember, digoxin toxicity also has GI side effects. So, it presents with nausea, vomiting, gastroenteritis जैसे होता है. Okay. Yes. Going to next one. So, what are the drugs which decrease the mortality in heart failure? Remember the drugs which are basically the RAS inhibitor, RAS system को inhibit करने वाला और sympathetic system को inhibit करने वाला. So you have ACE inhibitors, ARB drugs and beta blockers which will come here. So spironolactone, aldosterone receptor antagonist, enalapril, metoprolol and ARNI. आर्नी में कौन सा कॉम्बिनेशन आता है? साक्यूबिट्रिल एंड वल्साटिन. ठीक है. आर्नी इज ARB plus NI is neprilysin inhibitor. Okay, so sacubitril is this neprilysin inhibitor. ठीक है. Is this clear with everyone? ARNI is sacubitril valsartan combination used in heart failure. Okay. Going to next one, acetazolamide, which is carbonic anhydrase inhibitor. So what does it cause? It causes metabolic acidosis or metabolic alkalosis. Yes, Rupesh. Gliflozins like dapagliflozin is also used in heart failure, the SGLT2 inhibitors now. Remember, aceta causes acidosis. Okay, it causes metabolic acidosis. What does it block? What reabsorption does it block? It blocks the bicarbonate reabsorption. So the alkali is going out in the urine. So there is acidosis in the body. So on what part of the nephron is it acting? The loop of Henle, PCT, DCT, where is it acting? It is acting in the PCT. Majority of the reabsorption in the PCT, including bicarbonate reabsorption. What is it used for? Acetazolamide, apart like as a diuretic, very, very important. It is used for acute mountain sickness. Very, very frequently asked. It is used in acute mountain sickness. Okay, clear with everyone? Mountain sickness में use करते हैं और glaucoma में use करते हैं, angle closure glaucoma. Next one, which is that diuretic which is useful for nephrolithiasis. अगर पेशेंट में रीनल स्टोन्स है तो ये डायूरेटिक यूज करते हैं. कौन सा है लूप डायूरेटिक की? थायजाइड्स. It is thiazides. Why do you use thiazides when there is stones? Thiazides because they decrease the urinary calcium. ठीक है. Remember, loop loses calcium in the urine. Opposite, thiazides do not lose calcium in the urine. So there is hypocalciuria. ठीक है. But at the same time, remember that thiazides, they increase the lithium toxicity because they increase the lithium reabsorption. So thiazides with lithium should not be given together. Plus they cause hypergluc, that is hyperglycemia, lipidemia, uricemia, calcemia, not calciuria. Remember, it causes hypocalciuria. But in the blood, the calcium is increasing, hypercalcemia. ठीक है? Yeah. Going to next one. Antiarrhythmic. What is that antiarrhythmic drug which is used exclusively for ventricular arrhythmias post MI? It is not at all effective for atrial arrhythmia. What is that antiarrhythmic? सिर्फ ventricle वाले में use करोगे, atrium में नहीं करोगे. Ventricle में भी ischemic infarcted myocardium better है. Right, that is lignocaine. Post-MI arrhythmias, lignocaine important. So lignocaine belongs to what class of antiarrhythmic drug? Remember, lignocaine lignocaine, lidocaine is I, though. That is 1B. Though matlab second alphabet B. Remember, it is class 1B antiarrhythmic drug. Which is a broad spectrum class 3 antiarrhythmic agent which has classical side effects like thyroid dysfunction, pulmonary fibrosis, corneal deposit, skin deposit. It causes that blue man syndrome. What is that broad spectrum antiarrhythmic drug? Very, very important. Remember, it is amiodarone. Okay. Remember, amiodarone, iodine वाला thyroid को affect करेगा. ठीक है. एडजेसेंट टू एमआई मतलब हार्ट के बाजू में जो लंग्स है, पल्मोनरी फाइब्रोसिस करेगा, कॉर्निया में डिपोजिशन करेगा, स्किन में डिपोजिशन करेगा. दैट इज एमियोडेरॉन. ओके, दैट इज एमियोडेरॉन. वेरी वेरी इंपॉर्टेंट. राइट, कॉर्निया वर्टिसिलाटा. करेक्ट. Going to antihypertensives, which is the antihypertensive group of drug which blocks the breakdown of bradykinin. So the bradykinin levels are high, and that is why the patient has classical dry cough and angioedema. Cough and angioedema is seen with cough and edema. Remember, ACE inhibitors, C and E, they cause cough and edema. So ACE inhibitor group of drugs like captopril, lisinopril, enalapril, pril wale, they block the breakdown of bradykinin. ठीक है, clear with everyone? Yes. What drugs are safe in pregnancy? Antihypertensive drugs. Remember, the mnemonic is he likes my neonate, and that is why these drugs will not affect my neonate. So you can give these drugs: hydralazine, labetalol, methyl-dopa, and nifedipine, not nitroprusside. ठीक है? He loves my neonate. That is nifedipine. Okay? Very, very important. Please never ever forget this, that ACE inhibitors and ARBs are contraindicated in pregnancy. They affect the fetal kidney. Renal agenesis हो सकता है. तो ACE inhibitors and ARBs are definitely not to be given. Okay? What is the mechanism of action of minoxidil and diazoxide in hypertension? Yes. What is the mechanism of action of minoxidil and diazoxide in hypertension? Remember, minoxidil diazoxide, MDH. MDH वाला याद रखना. MDH, what is that? MDH is potassium channel opener. Okay. So this is potassium channel opener, KCO, potassium channel opener. They act as potassium channel openers. ठीक है? So which potassium channel opener is also used in insulinoma? To treat the hypoglycemia, it is used in insulinoma. Remember, it is diazoxide. Okay, it is diazoxide, which is basically used in insulinoma also, diazoxide. Next one, which anticoagulant is a teratogenic drug? So not to be given in first trimester. It causes fetal bleeding and bone deformities. Remember, warfarin is not to be given in first trimester. It is a teratogenic drug. Chondrodysplasia punctata करता है, CDP, chondrodysplasia punctata, saddle nose जैसा होता है. Okay, and which is safe in pregnancy? It is heparin. Okay, it does not cross the placenta. So what is the specific reversal agent in overdose of heparin? We had seen starting में protamine sulfate, chemical antagonism, protamine sulfate. What do you monitor with warfarin? What do you monitor with heparin? Physiology में देखा है. Remember the mnemonic happy. Heparin के साथ APTT, happy and wept, opposite emotions. Warfarin के साथ PT and heparin के साथ APTT monitor करते हैं. ठीक है? Is this clear with everyone? Warfarin, teratogenic, so not to be given in first trimester when embryogenesis, organogenesis is happening. Okay? Right. Tell me, which is the anticoagulant which is oral direct thrombin inhibitor? Which anticoagulant is an oral direct thrombin inhibitor? We have discussed anticoagulant in details in Sure Shot Extra Edge. Factor 10A inhibitors, right? Direct thrombin inhibitors कौन से हैं? उसमें से oral कौन सा है? Oral direct thrombin inhibitor is what drug? Very good. Preeti, smooth specialist, right? It is dabigatran. Okay, dabigatran. Remember, tran wale drug is thrombin antagonist. TR thrombin, AN antagonist, direct thrombin antagonist. Dabigatran is an oral direct thrombin inhibitor. Okay? Yes, idarucizumab is the antidote for that. Next one, diabetes mein, what is that drug which is first line for type 2 diabetes, but it causes lactic acidosis? लैक्टिक एसिडोसिस कर सकता है. कौन सा ड्रग है? डायबिटीज वाला ओरल ड्रग. Yes, it is metformin. Remember the trick for metformin? Met. Metformin causes metabolic acidosis, that is lactic acidosis. And what vitamin deficiency? Met for methyl cobalamin deficiency, that is vitamin B12 deficiency. Okay, met for metabolic acidosis and methyl cobalamin deficiency, vitamin B12 deficiency. Very good. Okay. Which parasite causes vitamin B12 deficiency? Which parasite causes vitamin B12 deficiency? Very good, Vinay. Correct. It is diphyllobothram latum. Okay, diphyllobothram latum. Correct. Correct, smooth specialist. Metformin, nephrotoxic जैसा drug भी है. So we have to check that the renal function before giving metformin. Okay. What are the drugs which drastically increase the urine glucose excretion? So the urine में glucose ज़्यादा आ रहा है. So the bacteria in the urine are happy that we are getting food. So they increase the risk of UTI and even Fournier's gangrene. Remember, Flozin group of drugs. Flow increase the flow of glucose in the urine, right? So that is SGLT2 inhibitor group of drug. SGLT2, remember, 2 comes in 2 kidneys, 1 comes in 1 eye for intestine. Okay, flozins, dapagliflozin, canagliflozin, ये सब आएंगे. Which is the alpha glucosidase inhibitor in the intestine, so it prevents the carbohydrate absorption in the gut. And that is why there's a lot of carbs in the gut. So that leads to flatulence and abdominal cramps. Which one is that? Remember, A-carbose, A-carbohydrate. मतलब carbohydrate को basically absorb होने नहीं देता है. A-carbose. Okay. So if the patient gets hypoglycemia on A-carbose, what you should give is glucose tablet. Do not give sucrose. You have to give direct glucose itself, not sucrose. Going to next one in gout, which is the drug which treats gout by binding to tubulin, so inhibits the microtubule basically, and it is acting on neutrophil motility. Its dose limiting side effect is diarrhea. What is this drug here? Remember, this is colchicine. What drug is this? This is colchicine. Okay, so colchicine is basically acting as an anti-inflammatory drug in acute gout. That is what you need the action in acute gout by preventing the neutrophil migration. Okay, it is acting on the microtubule. Is this clear with everyone? On the other hand, which is a drug which is not to be given during an acute attack? It is the best drug for prophylaxis, but not for acute attack. That is allopurinol. Very, very important. Asked so many times in exam. So allopurinol mechanism of action is, it is xanthine oxidase inhibitor. So that means it is preventing the synthesis, the formation of uric acid. Okay? You do not give it in acute attack. What do you give in acute attack? NCC drug. What is NCC? NSAIDs, corticosteroid and colchicine. Do not give allopurinol. Okay? Next one, what is this antibiotic here, which is a protein synthesis inhibitor, acts on 50S subunit. It is given in MRSA, plus it has the risk of serotonin syndrome if you combine with SSRI. Which antibiotic is described here? Which antibiotic is described here? We have discussed this in the recent TND session on the MedSynapse app as well. Very good. That is linezolid. Remember, linezolid can cause serotonin syndrome. Why? Because it's a MAO inhibitor. It has MAO inhibitor action. Okay. Very, very important. What are the other side effects it can cause? It can decrease the platelet count. It can cause optic neuritis. Okay. Remember, it acts on 50S. It is a protein synthesis inhibitor. That means it is bacteriostatic or bactericidal. Remember, the protein synthesis inhibiting drugs are generally static drugs. So, linezolid is a bacteriostatic. Okay, it's a bacteriostatic drug. It's useful for MRSA. It can cause serotonin syndrome. Okay, very, very important. Peripheral neuropathy bhi karta hai. Next one. What is the antibiotic group of drug which inhibits DNA gyrase? Topoisomerase 4, and it can cause cartilage damage and Achilles tendon rupture. So remember, when the Achilles tendon rupture, the patient gets to the floor, right? Tendon rupture ho gaya, so patient cannot stand, so floor pe chale jata hai. So remember, it is floor is fluoroquinolone. Fluoroquinolones, they inhibit the DNA gyrase, topoisomerase 4. ठीक है, फ्लोरोक्विनोलोन्स कार्टिलेज डैमेज करते हैं, तो बच्चों में लेस देन 2 इयर्स में हम नहीं देते हैं फ्लोरोक्विनोलोन. रिमेंबर, फ्लोरोक्विनोलोन ABCDEF के बाद आता है G, so it is acting on gyrase. Okay, it is acting on gyrase. Next one, which is this drug which is reduced by anaerobes, so it is effective in anaerobic infection. It forms the reactive free radicals which damages the DNA. So forming the reactive free radicals, it is damaging the DNA, plus it causes disulfiram-like reaction. What drug is being described here? Which is this drug which is being described here? Yes. Very good. Absolutely right. It is metronidazole. Okay, remember, this is the mechanism of action of metronidazole. DNA, right? It affects the DNA. It acts on DNA by forming free radicals. Plus, it has disulfiram-like reaction. Very, very important. Metronidazole disulfiram reaction. Frequently asked in the exam. Okay. TB में, what is the drug which acts by inhibiting RNA polymerase? Remember, R for R, it is rifampicin. राइट, रिफैम्पिसिन. इसीलिए इसका म्यूटेशन कौन सा जीन रेजिस्टेंस में आता है? RPOB, RNA polymerase. RPO is RNA polymerase वाले का म्यूटेशन. So rifampicin. Remember, other R is red color. The secretions become red orange, right? Red orange discoloration of urine, sweat is what is seen, and it is a potent inducer or inhibitor of cytochrome P450. It is a potent inducer, right? Therefore, it causes what of other drugs? Failure of other drugs, like failure of OC pills, failure of warfarin, failure of HIV drugs. ठीक है, so you do not use it when the patient is already on HIV treatment. तो हम rifampicin use नहीं करेंगे. ठीक है? Yes. What TB drug frequently causes peripheral neuropathy, right? And that is why you supplement vitamin also with it. Remember, it is INH. You co-administer what? Pyridoxine. ठीक है, that is vitamin B6. So B6 deficiency, okay, फिर neuropathy हो सकती है. Remember, it is INH. The slow acetylators, it is metabolized by acetylation. Remember, isoniazid. Remember, acid is acid. First of all, it causes acidosis, metabolic acidosis, and it is metabolized by acetylation. Isoniazid, acidosis, acetylation, plus it inhibits mycolic acid synthesis. 3-acid is what you need to remember here. The mechanism of action, it inhibits mycolic acid synthesis. What TB drug acts by inhibiting ATP synthase? What is that TB drug inhibiting ATP synthase? That is bedaquiline. bedaquiline. Okay, remember that is bedaquiline. ATP synthesis bedaquiline. Okay. Right. Going to next one. Cancer wale drugs. What drugs, anti-cancer drugs, act on the M phase? Remember, M phase का mnemonic है MTV. M phase पे act करता है T और V. That is taxanes and vinca alkaloids. Paclitaxel, vincristine, vinblastine, they act on M phase. Okay, they act on M phase. What drug acts on G2? Remember, 2 for bi. B wala drug, bleomycin. Okay, bleomycin acts on G2. Topoisomerase 1 and topoisomerase 2 inhibitor. Irinotecan. AN is ON1. It inhibits topoisomerase 1. Etoposide is topoisomerase 2. So irinotecan is 1 inhibitor. Etoposide is 2 inhibitor. Remember, irinotecan is contraindicated in what condition? You do not give irinotecan. It is contraindicated in Crigler-Najjar syndrome. ठीक है, important. Crigler-Najjar में irinotecan नहीं देते हैं. It is used in colorectal carcinoma. It causes diarrhea. You do not give it in Crigler-Najjar. Yes, we'll come to the side effects here. So toxicities and rescues. So what is the drug which causes hemorrhagic cystitis? Which anti-cancer drug causes hemorrhagic cystitis? Remember CY cystitis, CY. It is cyclophosphamide. Okay, it is cyclophosphamide which causes cystitis. What is this toxic metabolite which causes cystitis? It is acrolein. So what do you give to prevent this? You administer what? Mesna. Mesna is given to prevent this hemorrhagic cystitis. Bleomycin causes what irreversible, what organ does it affect? Remember, BB wale drugs affect both the lungs. Okay, both the lungs. That is bleomycin and busulfan. Okay, it causes pulmonary fibrosis. Plus, what does it cause? Bleomycin. Remember, bleomycin, blue mycin causing blue marks on the body. That is skin pe flagellate dermatitis. Okay, this is the drug which causes flagellate dermatitis. Previously asked question. Bleomycin, blue marks, flagellate dermatitis. Okay. Next one, the antiemetics that you give with this anti-cancer drug. Ondansetron is acting on what receptor? What receptor? Antagonist. Remember, citron is serotonin and TR is for tri. That is serotonin 5-HT3 receptor antagonist. Okay, so it is used to prevent the early phase of chemotherapy induced vomiting. For delayed one, what drug do you have for delayed? For delayed, you have aprepitant. What is the mechanism of action of aprepitant? It is NK1 antagonist. It is acting on receptor NK1. Okay, so ondansetron is serotonin 3, 5-HT3, and you have aprepitant, which is NK1 receptor antagonist. Okay. Yes. So that was about the today's short sprint pharmacology, guys. All these topics have been discussed in detail with all the tricks and many more important topics in pharmacology, the hypolipidemic drugs, monoclonal antibodies, immune checkpoint inhibitors, right? A lot of other drugs has been discussed in Extra Edge. Right, so all you need to do is have a short course subscription for this. We have various plans available on MedSynapse app, right, which you can access. It's absolutely useful for any exam. And as far as the question of the PDF for this session, right, comes, it will be uploaded in the short sprint course, the free course on MedSynapse app. And please give the test, the 10 questions test on the topics that we have discussed, and see how much of the stuff you have learned, how much of the stuff you are able to remember and recall, reproduce when you are giving the test. Okay, so that's all available in the short sprint course. The next class that we have that's going to happen in the MedSynapse app for subscribers, the ENT KBMD. What is KBMD? Kaun Banega MD, right? So it's a fun way of basically solving the MCQs. You solve the MCQs together. Everybody sees the question on their screen. The poll is live on the screen. And I give you a time limit, 15 seconds, 20 seconds, 30 seconds, depending on the question length, the difficulty of the question. And you have to mark the answer there, and then you get the leaderboard. Okay, the top 10 students on the leaderboard. So it's a live quiz sort of thing. So, and all of these KBMDs that we are doing are all based on recent PYQs. They are not the direct PYQs, but PYQs with a twist, right? So the next subject that we have is ENT coming up, which is going to happen on 18th. That is day after tomorrow. After that, we will have ophthalmology class on 21st and medicine class on 23rd. Okay? So that is the plan that we have for the in-app live subscribers. And the next sprint class that we will have is going to be microbiology. Okay, so that will happen on 20th. Right, so next sprint class will be microbiology on 20th, and these are the other in-app live classes for the subscribers. Okay, all right. What is the queries? Any queries here? The PDF, like I said, Ayushmari, that will be uploaded in MedSynapse app in the free course, which is Sure Shot Sprint, both blank and annotated PDF. Okay. I'll pin the link also of the course. You can directly click on that and you land on that course and you can get the PDF from there. So in the comments, I'll pin the link for the Sure Shot Sprint course. Right? Any other queries? So that was about the today's session, guys. Thank you so much for joining in. I hope you found it useful. If yes, please do not forget to like it and share it with your friends who might also find this useful. Thank you so much for joining in. Goodbye, take care, and keep studying, keep revising, keep med synapsing, and keep winning.